This short film will help you understand what to expect now you have been advised you need an operation, and will prepare you for your journey with us. We use a care pathway called Enhanced Recovery to get you better sooner. Enhanced Recovery allows you to take control of what is happening to you and to be more involved in your care. It makes you an important member of your care team. Your GP is also part of this team and needs to be involved in your admission and will work with you to prepare you for your operation. As part of Enhanced Recovery, you will need to eat healthily, take regular exercise and stop smoking. Your GP can help you with this. These small things will make a big difference to your enhanced recovery. At your outpatient appointment, your consultant will explain your operation and complete the consent form with you, giving you all the information you need on your operation and enhanced recovery, including the potential risks and benefits. Before you come for your operation, you will have a pre-operative assessment to ensure we have all the right information and that you are well enough for the surgery. This happens in the pre-assessment unit. Here they will complete the initial assessment in the enhanced recovery pathway by asking questions about your current health and lifestyle, and conduct some simple measurements, which will include blood pressure, weight, height, blood tests, and possibly a non-intrusive tracing of your heart called an ECG. For some operations, it may be necessary to attend a joint clinic where the nurse or physiotherapist will run through some exercises with you to prepare you for what to expect after the operation. If required, you will also speak to an anaesthetist who can advise about pain relief options and explain the anaesthesia. The pre-operative assessment nurse will supply you with the information you need for the time leading up to your surgery date and advise you of any lifestyle changes that need to be made. They will also give you the information that you will need before your operation, such as what time you need to stop eating and how long you will need to stay in hospital. You will be given information on what to bring into hospital with you, and you'll need to remember to pack your clothes, as Enhanced Recovery encourages you to get up and dressed and back to normal as soon as possible. As part of your Enhanced Recovery program, you'll be given some special cartons of drink that you need to have the day before and the morning of your surgery. These will provide you with carbohydrate and give you energy for your recovery. Remember to have a good meal the night before you come into hospital. When you arrive for your operation, our admission team will welcome you and check your blood pressure, temperature, oxygen levels and heart rate. You'll be asked to change into a hospital gown, and we will give you stockings to wear on your legs which will help with your circulation during surgery. You'll be given a wristband to wear which will identify who you are and highlight any allergies. They will then complete a checklist with you to make sure you are ready for surgery. The anaesthetist will visit you and ask questions about your health and discuss the anaesthetic with you. They too play an important part of your enhanced recovery. They will discuss the pain management you would like following your operation, and in some instances they may suggest an epidural or a patient-controlled analgesia pump known as a PCA to help with this. A member of the surgical team will talk to you about your operation to ensure you fully understand the procedure and ask you to countersign your consent form. Depending on the operation, they may need to draw an arrow on your body to mark the operation site. Please take this opportunity to ask any questions you may have. When it's time for your operation, you may be asked to walk round to the anaesthetic room, or the theatre team will collect you on a trolley. Here you will be looked after by the anaesthetist and anaesthetic practitioner. Once again, you'll be asked questions to confirm your identity and your operation. We know this may appear repetitive, but your safety is always our priority, so we must check this information at every stage. They will then insert a small plastic tube in your hand or arm called a cannula and attach you to a machine so that we can monitor you safely throughout your procedure. Once you are ready, you will receive your anaesthesia, which may involve a combination of going to sleep, an injection in your back, or an injection to make part of your body numb. In theatre, we will carefully move you into position and make sure you are comfortable. Your dignity is important to us, so we will keep you covered as much as possible and ensure you are warm and comfortable. Once the theatre team and surgeon are ready, another safety check is performed, then your operation can begin. When you wake up, you will be in our recovery area with specialist nurses who will take care of you and make sure you're as comfortable as possible, providing you with pain relief and anti-sickness medication if required. You may have an oxygen mask on your face and various wires attached to you. Please do not worry, this is all routine. As part of enhanced recovery, we encourage you to start drinking as soon as possible, and you may be offered a drink in the recovery area and asked to sit on the side of the bed to encourage blood flow, as you may have been lying flat a long time while undergoing surgery. They will look after you in the recovery area until you are completely ready to go to the ward. A nurse will be allocated to look after you on the ward and conduct regular observations, checking your blood pressure, pulse and temperature to ensure you are recovering well. You may have a small tube in your bladder called a catheter, and occasionally a tube coming from your body called a drain, which we try to remove as soon as possible, often the following day. You may have a bag of fluid attached to you when you return to the ward. This is used to replace fluid in the body during your surgery. As soon as you start drinking normally, this will be removed. Nutrition is very important in healing and enhanced recovery, so it is essential you take in more calories than normal to help with wound healing and give you energy to move around frequently. You may be offered high-calorie drinks to help with this, and it is advised to eat small meals more regularly, and we encourage snacking and plenty of fluids. The nurses will help ensure your pain relief is adequate to help you move around the ward, and you may see one of our specialists from the acute pain team, who will give advice on how best to control your pain and give instructions on when to remove the PCA or epidural if you have one. Enhanced recovery encourages you to take part in your care and daily activities like washing and dressing. Early mobilisation is important to help avoid complications like blood clots and chest infections. And we recommend 3 short walks a day around the ward. You may require some assistance at first, and the nurses can help you with this. You may also have a daily injection in your tummy to thin the blood to help prevent any blood clots. This is done with a very small needle and should not be painful. Visitors are encouraged from 3 till 8 p.m, and we ask for no more than 2, as it can get very busy and be tiring for you as a recovering patient. We don't expect to keep you in hospital for long and hope to have you home within a few days, sometimes even the next day. Your consultant may suggest a nurse-led discharge and allow the nurses to discharge you home. If not, your surgeon or one of their team may come to see you. You will be given information on the operation and discharge advice that will allow you to continue your enhanced recovery at home. Once you are at home, a nurse will call you the next day to ensure you are recovering well. They will ask a number of questions about your recovery, such as do you have any discomfort and if your wound is healing well. They will also answer any questions you may have. It is important to get up and about once you are home and follow a healthy diet so that you continue to play a part in your enhanced recovery. Eating a healthy diet will help to keep your bowels regular, which is important following your operation. Follow the advice on the written information you have been given, which will provide a number to call if you have any problems once you are at home. We endeavour to make your journey with us as comfortable and as safe as possible. By providing you with this information, we hope it reassures you and helps you play your part in your enhanced recovery and addresses any concerns you may have. We look forward to meeting you soon.